Hello, everyone. Welcome to another inspiring episode of Youth Aware. Today we have Callista Kennedy with us from Seattle, King County, and Public Health. And she will be sharing information about health insurance benefits, access programs for people with a limited income. Thank you for joining us today, Callista. How are you doing today?
I'm well, thank you. Thank you for having me on.
All right, so we would like to get started with our questions. And just to begin, Kalista, could you tell us what's your role in working with King County? What do you do? Just give us some more insight on that.
Yeah, sure. I'm a program manager with Public Health Access and Outreach team. And my specific role as a program manager is to manage the network of navigators that we have in King County. We're the lead organization for healthcare. And what that means is we organize and contract with participating hospitals, clinics, and public service agencies to help enroll individuals into healthcare in King County. So myself and all of our team are certified navigators. We help individuals enroll and get health insurance. And then we contract with about 33, 34 agencies that also service their own clients and help them enroll in health insurance. So we provide support, training, and backup assistance for those agencies. And so I kind of have a dual role in that I'm a navigator myself and I help people connect with insurance and the other programs we do at Access and Outreach, but I also help manage that larger network and make sure they have what they need to help people enroll in health insurance.
Wow, that's interesting. Thank you for sharing that with us. Along with this, could you describe what type of programs or what type of resources you have to help individuals out to get insurance?
Yeah. So what we do at Access and Outreach is we work to reduce barriers to not only health insurance, but other public benefit programs. So we contract with DSHS and we help people enroll through Washington Connection in programs like basic food or EBT. We help people with their other benefits, such as TANF assistance, Medicaid for the disabled, and Medicare savings programs for the aged. Also child care assistance, all those programs through DSHS. We work with the city of Seattle and the contracted agencies that do the winter heating assistance program known as LAHEAP to help people connect with energy assistance. We also enroll and help manage the Orca Lift enrollment for the reduced fare transportation programs. We also help people connect with medical and dental health homes if they're looking for a place where they can actually use that insurance. We help them connect with contracted clinics or providers that accept their insurance. Same thing with dental. We also work with the Washington Breast and Cervical Health Program, where we help individuals, women specifically 40 to 64 with mammograms. We actually host mobile screening events, but we also help them enroll through a clinic process where they can get connected to primary care and then get a mammogram. There's also cervical screening services we help people connect with that program. And then we also manage the Access to Baby and Child Dentistry program, which is an early preventative program for children aged 0 to 5. So we have a
Wow.
lot of programs on our slate that we help people with.
Yes, that's so interesting. There's various programs that you're involved in to get individuals connected with. So that's a great variety. I'm pretty sure our viewers, are going to be surprised that there's so many different programs out there that they can, get connected and get resources from.
Yeah.
So I do understand that in these programs we have to get enrolled. What does open enrollment generally mean? If you
So
could go.
generally, yeah, so generally open enrollment is in terms of healthcare, and it's usually a period of time in the fall. It usually runs through the holidays, November through December. This year, we actually extended through January. It's like an open period where anyone who's interested in getting insurance, changing insurance, looking for a new policy can enroll and select a plan to start for the upcoming benefit year, which would start January 1. So this year, we had more plans available to people, and we rolled out a new standard option called Cascade Care. So we actually had a longer enrollment period. For the past 5 years or so, it's always been November 1st through December 15th. This year we went through January 15th. So we had an additional 30 days to enroll this year, so that people could start their 2021 benefit year with new plans, and see all those new options that were available to them. So it's just generally an open period for people to enroll in healthcare. And then other times of the year, there has to be a life change that qualifies them to get an enrollment period, which usually only lasts for 60 days after that event happens. But there's a general period of time where everybody can enroll.
Okay, so just to let our viewers know that this programs you enroll in just as like the health insurance, and until like for example this year the deadline was until January 15th, and various years it may change as well. What if an individual misses the deadline? Like maybe they didn't know it was due this time, or they had other things going on in life. How do you like how would they compensate with that? What could they do in that situation?
So in normal times, every other year, you would have to have some kind of what they call qualifying life event. This would be something like having a baby or adopting a child, getting married or divorced, moving from one part of the country or one part of the state of Washington to another where your previous insurance isn't offered, so you lose the insurance because of the move. And those events give you a 60-day window to enroll. This year, due to the change in our presidential administration, the new administration through the federal site opened up what they call a special enrollment period. And this enrollment period this year is just for individuals who missed out for, and they're not actually making you specify a reason. You missed out on the enrollment for whatever reason. Either you weren't really sure and didn't go back and choose a plan, whether you weren't aware and you didn't try to enroll, or whether you have an insurance like Cobra, something that you elected to purchase outside of the exchange, and the exchange may offer you a better option. They've opened an enrollment period. It started on February 15th. It's going to last through May 15th, where individuals that are in those situations can come in and re-enroll. It's a good thing because there's been a lot of change this year to give people an extra opportunity to enroll. So it's an additional 60-day period for someone who is currently uninsured that would like to search out their health insurance options, that they can come in and shop and enroll in new plans. So we're in the middle of that. So we're getting the word out, and we're here to help people if they need to enroll.
What is the deadlines for that new enrollment? Like, what is the timeline between that?
So it started on February 15th and it will go through May 15th.
Okay. So that's a full, 3 months right
It's
there.
a full 3 months. So yeah.
So for our viewers, if you aren't able to, you didn't know about the deadline that was due on January 15th, now there's still an opportunity to get access to health insurance up until May 15th due to this new enrollment period. All right. And then how could you go over like how do like I'm aware that since wasn't aware about all these programs, there might be individuals that didn't know about them either. How are we able to learn more about it? Where we could get more information?
So you can get more information on our website, which you see behind me on the screen, which is kingcounty.gov/outreach. If you go into our health insurance tab, it says actually free and low cost health insurance, because we do also have information on the Washington State Apple Health Program, which is our Medicaid program for low income individuals. We also have that information included as well. And that program you can enroll year round. So there's no specified periods for that, but information on how to enroll, income guidelines, are all on our website. In addition, there's also a registration about midway through the page where you can put in your contact information and request that a navigator actually call you back directly, and set up a time with you to discuss your enrollment options, and any questions that you may have regarding not just health insurance, but actually any of our programs. We can assign someone to help you with that.
That's great information to know. So just for everyone to know that kingcounty.gov/outreach is the website to go to where you can get more information. And as Callista noted, that even if you are having trouble navigating the page, you trouble, understanding what's going on, you can have a navigator call you and let you know about the programs, and you can talk about health insurance and other programs as well for more information. This is a great way to actually, get to more of the community involved and have their resources met and their needs met too. Thank you for doing that with public health. Thank you so much, Kalista.
Oh, thank you.
Additionally, since we have, very different, diverse population, what would you say are some options that immigrants can have and how they can receive health and resources?
Yeah, so one of the great things about our team is we are a very diverse team. We have navigators that speak actually 7 different languages on person. So that for those languages that we do have available is a great option because they can speak to a navigator that actually speaks their language. For the rest, we do use interpretation services. But we, like I said, our program is focused on the community as a whole. So, we just encourage people to reach out to us because even if it may be something that we don't provide ourselves, we can usually connect with that resource. For example, when we talk about energy assistance, we do direct assistance for the programs offered by Seattle City Light. Um, but Puget Sound Energy, it's particularly when it comes to South King County, they have other service providers. So we make a point to actually be in contact with entities such as the Multi-Service Center. So if someone is having trouble, we can help assist and make that more kind of direct handoff to that service agency. So we try, to connect with other services that, like I said, if we're not the contractor, if we're not the provider, that we can, help make that direct connection more readily available to people.
That's actually really great to know how there's so many diverse languages you said right there. So if someone, is immigrant and they're maybe not well reversed in English, they can still get access to these programs, and you'll have, either interpreters or actually people that work with King County to be able to contact them to make them understand their needs, and have those needs met. So that's really great. And then moreover, Kalista also talked about how they can also help you transfer or direct your care to other sources too. So that's another great factor in this program as well. Additionally, is there resources for free health insurance, since we do know health insurance can be very expensive to afford?
Yeah. So our Washington State Apple Health Program is, depending on the household, for adults is set at, it's used at federal poverty level standard, which is used for most programs. That current limit is 138% of the federal poverty level. To give you an example, it goes up by household size. So if you're a single adult, you're talking gross income less than $1,468 a month. So it's still a pretty low income guideline. It also has federal citizenship and or residency requirements that you have to meet. So sometimes, even though someone may be below that income limit, it tells them to purchase insurance because they don't meet those federal residency requirements, which can be an option that is not exactly affordable because they've already said by setting this free standard that if you're below 138%, you really can't afford to pay for insurance. So while some people do manage to opt with tax credit assistance to buy insurance, at times we do need other options. So one of the things that we do is we connect people with what's called our community-based healthcare centers, or a lot of people refer to them as the public health clinics, even though they're not actually the public health sites. Public health does have 2 locations that do primary care, which is our downtown public health, which focuses on healthcare for the homeless. But then they also have our Eastgate Public Health Clinic, which is a clinic that does all age care. So it has primary care for both adults and children. But that's on the east side, so it's up at Eastgate, which is a great option for people if they have it. And usually it's no fee, because most people going there would normally meet that income standard for Apple Health. However, our other healthcare centers throughout King County that actually provide services on sliding fee scales. And while they don't normally drop all the way to zero, most of them have some kind of minimum fee that kind of ranges anywhere from a low of $5 up to about 35 would be minimum fee. And these are the clinics like ICHS, the International Community Health Services, which now has 4 locations, the CMAR locations, Health Point, Neighbor Care, those types of clinics that offer that sliding fee scale. In addition, if someone needs hospital-based services and goes to the hospital, there can also be the Alien Emergency Medical Program, which is a program through the Healthcare Authority to help pay a bill, or charity care. And some of the hospitals, such as Swedish and Harborview, their outpatient clinics also extend those charity care options. So someone may do a charity care application for a hospital visit, but need follow-up in one of their outpatient clinics, and that charity care in those larger clinic systems often transfers over to the primary care visits at the regular clinics.
All right, so you guys can see that even if you don't meet exactly, Washington Apple Health, there's still different so many resources right there. There's the Community Health Access Program, there's outpatient clinics, inpatient clinics that do the charity system where you don't have to pay as much as, as health insurance might cost out at other places as well. So that's great information to know, and that's the way we can help our communities too to get so much access. I've actually heard about a lot of community health clinics such as CMAR. I know some people that go there to get treated, and that's actually very beneficial for them too. It's a program that meets their requirements and somewhere where they can actually afford to go. All right, what's a different ways, that we can get help with enrollment and more additional resources, and just like ways we can get more information, routinely about these programs?
Yeah. So I again would encourage people to visit our website. We have a lot of information on that site, not just about free and low cost healthcare, but for example, the list of those community-based clinics that we maintain and take out with us when we do outreach are all posted on that website. We also have information on the Orca Lift program, which is the reduced fare transportation program, and how to get cards either in person by phone, where we would mail them to you. There's a new online portal that just started up for that program as well. We also have information on things like we have a section for other types of services that you can get by having basic food. So when you have basic food, you have access to things like free and reduced price lunch, those free cell phone programs. There's a discount program on the little scooters through Line Bike, where if you have your EBT card, the museum program, where you can visit certain museums, hopefully when they're more open, where you can, with an EBT card, for example, Mopop, you show your EBT card at Mopop and 2 adults and 2 children get in for free. So we have information on those types of programs as well, all posted on that site in little drop-down tabs. We actually created, our team created a resource guide specifically targeted at the immigrant population that I'm working on getting it posted differently. I just want to say that forefront, because right now you have to choose the little tab that says information in Spanish, and then it's all the way at the bottom in the resource tab. It does need to be more front facing, but because of the project was originally developed by the team that works in our Latinx community. Right now, that's where it initially got posted to get the initial push, but it's a great guide actually for all immigrant populations. And like I said, while it was developed by that team, it's not specific to the Hispanic population. It has a ton of immigrant-based resources. So we have a lot of information about the things that you can access and where to access them. And like I said, not just the programs that we do specifically ourselves, but other programs that are connected to the benefits that we connect you to. So we connect you to EBT, we can connect you to this service and this service. So we've tried to make those connections so that they're more readily available to people.
Mhm. I would encourage our viewers to really take this into account to visit that website right there, kingcounty.gov/outreach, to see all these resources that are available to you. As you know, individuals, we might not be aware of what there is out there that can help us, what resources are there. But like just interviewing Callista, I was able to learn so much and get educated about these programs, and I'm sure everyone would like to learn more. So I would really encourage everyone to visit that website right there and see all those various programs, not just health insurance. As Callista noted, there's different programs, whether it's ORCA, EBT, other additional resources that they can get you connected to. So this is a great way for everyone, to get their healthcare access, other needs as well, assistance, things like that, that we can all encourage our community to get involved in so everyone's needs are really met. I would like to thank you so much, Callista, for taking your time out to give us time to interview you, to educate everyone about these programs. And really, like, great, like, thank you so much that you're part of such programs that try to work to give healthcare access to the community, and moreover, just try to give community resources that they can connect to and get more, education and more improve their quality of life out here. Thank you so much, Cleesta.
Oh, you're welcome. I'm so happy to come out and, provide this resource. And, if anyone, needs enrollment in healthcare, like I said, call us or, submit a registration to get connected with the navigator. We're really happy to help. And last plug, there's also a calendar. We do have some face-to-face, one-on-one, actual open locations right now. We have two what we call storefronts, one in Federal Way and one in downtown Seattle, that actually are open about 4 days a week each, where people can actually come if they feel they need face-to-face help. But we also do have special events where, with PPE and face shields and everything, we're able to help actually in person as well. So we encourage folks to come out and visit us if they need to do it that way, if it makes them more comfortable. Because sometimes with health insurance, particularly, you want to see what you're buying. So
Definitely.
we're certainly able to help with, like I said, with all the social distancing bells and whistles set up for everyone to be safe. So
Yeah, as you
um,
guys can see that there's so many resources out here that Lisa is talking about. Even if you're not able to, have a Zoom appointment, things like that, even in person, there's sources that you can go to. So there's very different aspects for everyone to get involved in to outreach. And it's a way for the community to, have their resources met and have, whether it's interpreters, translators, all those members as well involved in this. And this is I would really encourage all of our viewers to really take use of this opportunity, educate yourself, educate people that you know that would like access to such resources, and just the general public about what is all around us that is available for us that we may have not known about before. Thank you, Callista, so much for your time. And I'd like to thank Public Health in Seattle King County to give us the opportunity to be able to interview them about their resources.
oh, you're welcome. Thank you so much for having us on today.